Argentinian flag sign is a common complication which is seen during capsulorhexis in a mature intumescent cataract. Here I'll be showing a video where I have made a double rhexis which prevents the Argentinian flag sign. Here I have used a capsulorhexis needle to puncture the capsule under adequate viscoelastic cover, and I use a capsulorhexis forceps to make a small rhexis, around 3 mm size rhexis, in the first go. So this should be done under adequate viscoelastic cover so that a good tamponade is present and the rhexis does not run away. Following this, I'll be decompressing the bag, which will prevent further runoff of the capsule. So while decompressing the bag, I use my phaco probe and I decompress. I am in the sculpt mode here. I remove a little bit of superficial cortex here and also a little bit of the nucleus so that the bag is decompressed. I am rotating it 360 degrees. Of course, there is no need for any hydrodissection as it is a mature cataract and there are no corticulocapsular adhesions. Now is the time to enlarge my rhexis to the adequate size. For this I have used a Vana scissor. We can use a micro rhexis scissors as well, and I have made a small tangential cut, and under good viscoelastic cover I use my capsulorhexis forceps to make a rhexis of adequate size. With this I will proceed with phacoemulsification just like any other routine cataract. So this is a good way to prevent Argentinian flag sign and the rhexis from running away. I am using stop and chop method for phacoemulsification here. So first I am making an adequate sized trench. Since it is a hard cataract, the trench should be wide and it should be deep. So as you can see, I am widening my trench so that my phaco sleeve and tip can go down into the depth of the trench. Once I reach the adequate depth, I crack the nucleus and make sure that 2 heminuclei are achieved. This is the most important part. Cracking should be good. And now I chop both the heminuclei into smaller pieces. Each heminucleus can be chopped into 2 pieces or even smaller pieces, and then in the quadrant mode we can proceed with phacoemulsification. I do the same with the second heminuclei, and first I chop this into smaller pieces and phacoemulsify it. I make sure that the phaco probe is steady and always in the central safe zone, and we can use the second instrument to chop the pieces into smaller fragments. Now I'll be proceeding with bimanual irrigation aspiration. For this I do not use visco, rather I keep my phaco probe inside the anterior chamber with irrigation on, and I use the side port and change hands to make the first and the second side port, and use hydroimplantation technique after IA.